With their medical knowledge, doctors play an important role in society by helping the sick. However, there are some things that doctors would never share with patients. Some of these secrets pose risk to their careers, and in some cases, patients are better off not knowing about them. If you dare to know, then stick around for these top 10 secrets doctors don't want you to know. Number 10. Doctors misdiagnose a lot. You may think doctors are perfect and incapable of making mistakes, but the truth is, like other people, they also make mistakes from time to time. In a 2015 study done by the U.S. Institute of Medicine, almost 12 million Americans will receive an incorrect diagnosis once in their lifetime, a rather bleak statistic considering that human lives are at stake. Another piece of research done this year stated that 20% of people with life-threatening conditions were diagnosed incorrectly. Understandably, it's extremely hard to pinpoint an exact diagnosis for every case, especially since there's tens of thousands of diseases and hundreds of symptoms to analyze. However, they are getting better at correctly assessing people's medical conditions. If you feel that you've been misdiagnosed, having a second opinion wouldn't hurt, especially if you're suffering from a life-threatening disease. In fact, most doctors would seek the assistance of their colleagues if they have trouble diagnosing their patients. Do not hesitate to seek another medical professional's help. It is for your own good after all. Number 9. Mortality rates differ between hospitals. Different hospitals have varying degrees of success when it comes to treating patients' medical conditions. One hospital may have had successes in performing certain types of treatments or surgeries, whereas other hospitals may not have as much experience or success, which, as you could imagine, is bad news for some patients. There are many factors that influence this disparity. For instance, one 30-day study conducted early this year showed that teaching hospitals have lower mortality rates compared to non-teaching hospitals, an 8.1% mortality rate compared to 9.6% at non-teaching hospitals. This is likely due to the fact that doctors in teaching hospitals have greater experience and are more up-to-date with current research compared to doctors at non-teaching hospitals. Other possible factors, according to research done in 2010, are hospital occupancy and seasonal diseases. Essentially, patients afflicted with seasonal diseases can unwittingly infect an entire crowded hospital, thus increasing risks to other patients. Deciding which hospital to go to can be a crucial choice, so take some time to know more about the hospital before you decide to enlist their services. Number 8. Doctors can be secretly rude. Doctors can be very patient, but there are times when that patience wears off, especially when dealing with problematic patients. Angry patients, patients who think they know better thanks to Dr. Google, and patients that lie and withhold vital information are some examples of patients a doctor doesn't want to encounter in the emergency room. Doctors want to connect with their patients in order for them to perform their work, but if their patients don't cooperate, you may find yourself being laughed at and insulted, albeit sneakily, by your doctors and their colleagues. Through the use of doctor slang, they may insult you without you knowing. One case involved a doctor who got into trouble after he wrote the abbreviation TTFO, which means told to f off, on a patient's notes. The next time you visit a doctor, be mindful and be respectful of their profession. Tell them what needs to be told. Be a troublesome patient, and you might get a prescription of CLL. That's the abbreviation for chronic lowlife, by the way. Number 7. Doctors are influenced by pharmaceutical companies. You may wonder why some doctors are especially pushy when it comes to prescribing brand-name drugs. If your doctor is one, chances are that he's being influenced by pharmaceutical companies. Research conducted in 2016 showed that for every payment to physicians that pharmaceutical companies spent, the median of which was $13 to each doctor, they could expect that doctor to prescribe their marketed medications for the next 3-month period. Gifts such as free trips abroad and/or other material things yield even better results, as doctors tend to then prescribe their medications for over a year longer. It's also worth mentioning that results from research carried out by pharmaceutical companies is easily manipulated, further influencing doctors into prescribing certain branded medications. This presents quite a risk to patients, as these medications may not be the best option available to them. Fortunately, most doctors will be willing to give patients cheaper generic medications, but only if they ask about it. If you want to cut down your medical expenses, be sure just to ask. Number 6. Hospitals have different prices for the same procedure. Unless you live in a country with universal healthcare, being aware of hospital fees is important. Surgeries and other forms of complex treatments can cost a lot of money, but did you know that different hospitals can offer drastically different rates for the same medical procedures? A 2015 study by CMS proved this fact. For example, A joint replacement at the Chickasaw Nation Medical Center may set you back around $7,492, while the same operation can cost you up to $235,132 at the Memorial Hospital of Salem, a jaw-dropping 3,300% increase. Even more surprising is that Medicare, one of the leading national insurance programs in the U.S., pays the former an average of $16,585 per procedure compared to $13,654 to the latter. The prices continue to drastically change every year, which serves to confuse both medical institutions and hospital patients. As always, checking the hospital's rates before admitting yourself can save you a lot of money in the long run. Don't forget to check if the hospital supports your insurance programs as well. Number 5. Your doctors probably don't communicate with each other. Poor communication can lead to disastrous results, and this is especially true in hospitals. Most patients assume that all attending doctors already know about their medications and treatment plans given to them by their official doctor. After all, they work under one hospital, right? Unfortunately, this isn't true for most cases. Miscommunication happens all the time in hospitals, and it can be really deadly. One piece of research conducted in the U.S. from 2009 to 2013 showed that poor communication between doctors resulted in more than 1,700 deaths, accounting for 30% of malpractice claims, costing hospitals up to $1.7 billion in the process. Examples of poor communication were no communication with regards to the patient's current condition, incomplete and poor documentation, and not reading the medical records. Patients, even though it's not their main concern, should play an active role in order to rectify and resolve these miscommunications. This simple act may actually save their lives in the future should problems arise. Number 4. Avoid July and weekends. It's impossible for you to control health emergencies, especially when you require immediate medical attention. But as much as possible, steer clear of hospitals during the summer months, especially July. According to a 2011 study by the Annals of Internal Medicine, mortality rates often increase during the month of July, up to 33% when compared to other months. This can be attributed to the arrival of new medical graduates and the departure of more experienced medical residents. In addition, research from the UK concluded that weekends also suffer from higher mortality rates, as patients are 16% more likely to die compared to being admitted on a weekday. Fewer staff and limited access to diagnostic tests were pointed out as the main reason why weekends have higher mortality rates. In direct contrast to this, however, is the fact that teaching hospitals have overall lower mortality rates, even when faced with a July or weekend effect, or both. This may be because, as mentioned before, more experienced medical residents oversee newly graduated students to assist them in their first day of treating real patients. Number 3. Doctors aren't rich. Most people view doctors as well off, being able to lead a life of luxury and extravagance. Truth is, they aren't. For starters, many accrue huge debts throughout their stay in medical school, not to mention that they have to pay for books and the medical apparatus that they will use. Once they graduate, they'll have to pay to become a medical resident at their chosen hospital. In the US, all of this adds up to about $300,000 after about 8 years. Add 20 years interest to that, and you'll end up having to pay more than $600,000 in total to become a doctor. And once you attain your goal of becoming a doctor and paying off your debts, you'll have to pay an average of 28% federal tax per year. Not to mention that most doctors end up overspending in order to cater to their wants. To put it into perspective, by calculating income after loan debts and dividing that by lifetime hours worked, doctors make 3 cents less per hour than high school teachers over the course of their career. You may ask why doctors choose to stay as doctors if they can earn more money doing other jobs. Maybe it's because their passion outweighs their need for money. Otherwise, the smarter doctors would immediately pack up and search for another profession that can support a more lavish life. Number 2. Doctors tell white lies. Doctors have it tough. It is painful to see a patient's family break down in tears after telling them that their relative might succumb to their diseases. Nevertheless, doctors always offer hope in the form of white lies. Doctors employ many forms of white lies to console their patients. Starting with the most common lie for child patients, "This won't hurt a bit," which is often said before something that hurts a lot. There is also "You're making progress," which is a way for doctors to convey that there is hope for you, if you follow through their treatment plan. The most heart-wrenching white lie to convey, however, is to tell that the patient will be all right, when in truth, the outcome is likely to be bleak. It's hard for doctors to experience the pain that their patients are going through. What if it happens to one of their relatives? Would they be there to save them? All of these questions lead to the last entry of this video. Number 1. Doctors are prone to depression. Having to deal with the constant pressure of meeting with clients, dealing with angry and troublesome patients, family issues, and consoling the loss of a family's loved one can take a toll on a doctor's mental health, which often leads to unforeseen consequences. Depression amongst doctors is quite common. Research shows that medical students and interns are up to 30% more likely to get depressed than the general populace. The research also states that depression is more prevalent amongst female doctors compared to male doctors. Depression is also linked to some cases of suicide amongst doctors, as depressed doctors are 3 to 5 times more likely to commit suicide compared to the general populace. Although they have a wide variety of treatment options, doctors choose not to treat themselves for fear of getting ridiculed by their colleagues. Independent research done by an MD stated that only 33% chose to pursue treatment, with the remaining choosing to take care of themselves through medication. While treating oneself may be an effective solution, pursuing an effective treatment plan produces better and fruitful results. Doctors are just as human as us. They're not infallible as most people portray them. The next time you pay a visit to your doctor, treat them with utmost respect and thank them for their selfless service to society. Let me know what you think of doctors by leaving a comment down below. Thanks for watching.